Hi, Dave Butler here. I wanted to talk about a recent research article that came out that looked at long-term supervised scoliosis-specific exercise treatment and whether that is more beneficial than a non-supervised home-based program. So if you're looking for Schroth Method exercises, you're doing them yourself or doing them on your own, or working with a therapist to do that, this research article is pretty interesting, and I think there's more research to be done on this, but it brings up some really interesting points and some really good thoughts on how we can get the most benefit out of Schroth Method exercises. And the title of this is Effects of a Long-Term Supervised Schroth Exercise Program on the Severity of Scoliosis and Quality of Life in Individuals with Adolescent Idiopathic Scoliosis, a randomized clinical trial study. That's a long title, but let's break it down a little bit. They're looking at long-term, so doing Schroth Method exercises with a therapist supervised long-term. So in this case, that's 12 months. And they're looking at the severity of the scoliosis, so the Cobb angle. They're looking at the quality of life. They're also looking at a bunch of other metrics that they're going to compare, looking at, whether this long-term approach is better. There have been a lot of studies on Schroth Method exercises that have been short-term, some up to 3 months, some up to 6 months, but there aren't very many that actually go into 12 months of supervised treatment. And that's a significant investment. If you're doing Schroth Method exercises for 12 months, that's an investment in your time and finances and everything else. So if that is effective, then the investment is worthwhile. But if it's not effective and we can get away with home-based exercise, then great. So this looked at individuals that were 10 to 18 years old, and it looked at, let me just get down here. So they had to have a Cobb angle between 10 and 45 degrees. They had to be a Risser grade 0 to 3. So 0 to 3 means they have growth left. They're not tapering off on their growth. And that was basically it. So they measured a few things. They measured the Cobb angle. They measured the angle of trunk rotation, which is with a scoliometer. That's what we use in the clinic. They did a SRS-22 questionnaire that looks at pain and deformity, and as well as how well they're doing in multiple aspects of self-image and mental health. And then it also looks at satisfaction of treatment. And they looked at, they did bracing for both groups, because these were curves that were in the 30 degree range or above. They looked at bracing both groups. And the braced group, they received instructions on the proper use of the brace and recommendations for engaging in physical activity without following a specific Schroth exercise regimen. And the exercise group was braced as well, but they were seen 3 times a week for 12 months for 60-minute sessions 3 times a week. That's a lot. You multiply 12 months or 52 weeks by 3, that's a lot of sessions in physical therapy. And those were hour-long sessions. That's a big time commitment. And we'll talk about that more in a minute, but there wasn't much difference between the control group and the experimental group related to their Cobb angles or any other factors. And their conclusions, the Cobb angle and the ATR, or the rotation of the spine, was significantly better in the experimental group. So the ones that did Schroth plus bracing saw a statistically significant difference than the ones that were just braced. So this is, as a Schroth therapist, this is what I hope it shows. but it was interesting to see that it was above the 5-degree mark that is kind of the minimal detectable change. And so the experimental group was at least 5 degrees better in their Cobb angles than the control group that were just braced. So this study did show that there was statistical significance when it came to Cobb angle and the rotation in the spine, as well as the SRS-22 questionnaire results. So those are all great. Those are all good things, and that was at 12 months we were seeing that benefit. The SRS-22 scores were also better 6 months after that still, as well as the angle of trunk rotation was still better 6 months after. So now let's get into a little bit of discussion. What does all this mean? That's a lot of information. That's a lot of study lingo and stuff like that. What I really want to have come across with this is, do we need to be doing longer supervised treatment with our Schroth patients? I know there's a push in the US to go more towards home-based therapy with not just scoliosis, but I mean, heck, I see knee replacement patients that never see a PT. They do a virtual visit. And where our system is trying to reduce how much people are being seen for cost savings, but is that sacrificing some of the benefits that we see from actually getting supervised treatment on a regular basis? This study looked at 12 months of treatment and the results from that, and I think that's fantastic, because this is not something that's going to go away in 3 months. These kids are still going to be growing. They're going to need follow-up and supervised visits. And I think if we're trying to either learn Schroth Method exercises online or teach them real quick and have them do it at home, I think we're doing a disservice to these kids, because they're learning this, they're taking the time to learn it, but then we're not making sure they're doing it well. I don't know that 12 months of 3 times a week at 60 minutes each visit is something that is doable in most cases. It might be, and heck, if it's doable, let's do it. It seems like it's more effective. But do we need to be going longer? At Align Therapy, we usually see someone for Schroth training for about 12 visits, and then we move to a 3-month follow-up program where we're following up with them, reviewing, and making sure they're doing well every 3 months. Maybe we need to do more consistent than that. Maybe it needs to be once a month. Maybe it needs to be twice a month. And maybe we'd see better results long term with that. And so just something to think about. You know, we definitely see benefits in the Cobb angle. We definitely see benefits in the look of the scoliosis, which is what the rotation is looking at. And we definitely see benefits in the SRS-22 questionnaire, where kids are having better body image, they're feeling better about their back, they're having less pain, and they're liking treatment. Maybe not liking treatment, but they're satisfied with treatment. And how do we carry that over longer term? I mean, a lot of the kids that I see with scoliosis are being seen for years. This isn't a 3-month thing. This isn't like, okay, 3 months, keep this up for 6 months and we're in the clear. This is a long-term thing. And if we can couple this with doing long-term treatment that's supervised and directed, along with dosing treatment, like I've talked about in other videos, dosing treatment in a way that we're really hitting it when the kid is growing, then I think we can avoid burnout, and we can get the best effect from the treatment as well, and help these kids avoid surgery. But more than that, help these kids avoid progression of their curve. It's not just about surgery. It's not just about reducing the need for surgery. It's reducing the impact of the scoliosis on the child and helping them to live their best life. So I think this is a good study to look at. It confirms a lot of the things that we've been looking at for a while, And it just helps us to see that maybe a longer term treatment period is beneficial, and it's something that we'll probably look at incorporating a little bit more into Align therapy. And hopefully this was helpful. These research reviews, I like doing them because it helps me to stay current with what's going on in the research. And hopefully it's helpful for you to understand what's going on as well. Look for the link to this study. I'll put it in the description. And don't forget to check out our other research videos, as well as if you're interested in Schroth Method exercises, we have a lot of videos that you can check out about Schroth Method exercises as well. So thanks for watching. I appreciate you, and I appreciate you subscribing and following this channel. And we'll see you next time.